Put a reasonable cap on pain and suffering. Make sure that people can sue in the case of clear malpractice. But it is not to be a lottery system. And so tort reform had to be part of it. Secondly, we said we ought to expand the usefulness and the flexibility of health savings accounts. Those independent personal spending accounts for health care. I would bet that a number of you have HSAs. And yet they are so restricted. You can't continue to let them roll over and let them build to a point that they are very useful for whatever you might need at a point in time. Or they're not flexible enough that you can take them and use them to purchase better health care with it. Why not? If we want to encourage people to be responsible. So we offer expanded and more flexible health savings accounts. We would offer also for the first time in my proposal, and what was in the Republican proposal this term, the opportunity for small businesses to join together for economy of scale in associated health plans. The associated plan would allow, for instance, a group of small independent contractors to join together to be able to purchase health care coverage for their employees and have a larger pool to develop their case from. The big three has done that. Major industry has done that. Government does it. Why not let small business do it as well and encourage them to work that way? So that's another component. We also said that we would make it legal for the purchase of health care across state lines. Why is that? Well, there are states that have better health care coverage for certain key issues, whether it's senior issues. And I'm very cognizant of that right now. My wife isn't yet. She's not a senior. Right, Sue? Right, that's absolutely right. I robbed the cradle. There are better health plans in some other states for oncology coverage. Regardless, why not give people the opportunity to shop around for the best health care plan they can? Plus, to give more competition to health care providers in our state or other states and vice versa. Again, the key issue is to make sure that people have the best opportunity possible to be responsible, to care for themselves, and not be a burden to any stretch of the imagination, and certainly not to have any reason that the only choice I have is to go to the emergency room. So, purchase across state lines, allow that. And then a final component, which I think is a key component, that we offered a refundable tax credit, or voucher, if you would call it that, to any individual or household who purchased health care coverage. And that refundable tax credit was based upon your level of earning, of course, your relationship to the poverty level, or whatever else. So it would be a sliding scale, but nonetheless, it would take away any disincentive for a person to have at least a comprehensive health care plan. Thus, expanding the pool of people insured, thus taking out the majority of reasons for going just to the emergency room. And there's really no incentive not to use your refundable tax credit, because if you don't use it, you're losing it. If you use it, it's paying for insurance for yourself. So those are some of the things. Now, since then, Republicans have put in language dealing with pre-existing needs, setting up, for instance, a high-risk pool, like we do with our auto insurance here in this state, to cover red line areas or areas where high risk and high cost for coverage of insurance for autos is at. That can be put in place as well. So ultimately, at the very worst case scenario, you've limited drastically the number of people who could actually say, I don't have health care, or I don't have the availability of health care. Now that's an approach that could be very useful, and that's what I would offer as an alternative. And when people say, but we passed something, I mean, why would you want to just go backwards? Well, what was passed by Mark Schauer and others doesn't go in effect in 2013, 2014 anyway. Any of those components that I just told you about in my legislation could be done piecemeal. We could start to repeal and replace this year